on the request of Honorable Finance Minister and Health Minister, I have to continue with the other subjects, sir. Now coming to the discussion on the measures taken by the government for strengthening the health sector in the state, I would like to touch upon few issues, sir, compared to the situation that prevailed at the time of formation of Telangana state in June 2014. There has been a tremendous transformation in the medical and health sector in the state, sir. Thanks to the various initiatives taken by the government and the higher budgetary allocation made for medical and health sector in the state budget for the last 10 years, Telangana has crossed several milestones, overtaking many other states in the country when we talk about the field of health, sir. I compliment the Telangana government for achieving full immunization of children, 100%, sir, in the year 2022. I congratulate the health minister also for this, sir. In the year 22, sir, the infant mortality rate has decreased to only 211 now, sir. This is also a very big achievement by the Telangana government, sir. The state has filled up to 22,455 vacancies of doctors, nurses and paramedical staff in the last 9 years, and recruitment of another 6,880 nurses and other paramedical staff is in progress, sir. I congratulate the government for this achievement, sir. So the government has decided to set up medical colleges in each of the 33 districts in the state. From only 5 government colleges in 2014, the state now has 26 government medical colleges, and 8 government medical colleges have been sanctioned recently also. I congratulate the finance minister, I congratulate the government of Telangana, I congratulate the Honorable Chief Minister Saab, KCR Saab, under whose leadership the health sector is growing and achieving a milestone, sir. The Honorable Speaker, sir, the state has highest number of MBBS seats per lakh of population and second highest postgraduate seats per lakh population. The number of MBBS seats in government medical college has increased 4-fold to 3,550 now. The number of PG seats in government medical colleges more than double to 1,316 now, sir. Sir, Honorable Speaker, sir, when I congratulate the Honorable Finance Minister and the Health Department, and also the Honorable Chief Ministership, under whose able leadership this achievement is happening. At the same time, sir, through you, I would like to ask the Honorable Finance Minister Saab, when he rises to give a reply, kindly give us a reply as to what is the amount that is spent to make one MBBS doctor. What is the money that is incurred to make one doctor? Also give me the details as to what is the amount that is incurred to make one postgraduate. And also the amount incurred to make one super specialist. Sir, the reason why I am saying this is, sir, that people need to know that what is it that the government is spending to make one doctor. What is it the government is spending to make one postgraduate? What is it the government is spending to make one super specialist? Sir, and at the same time, sir, through you, I would like the Honorable Finance Minister to give the details as to how much of faculty, how much of teaching and non-teaching staff is required for establishing one medical college with a hospital, sir. Also kindly give a detail as to what is the amount that would be incurred per month and per year, sir, on establishment and running of one medical college with a hospital, sir. People need to know that. People think that it's very easy to establish a medical college and a hospital. It's not that easy to establish a medical college, because we run a medical college, we run a hospital, we know how tough it is. It is very tough, sir. Sir, at the same time, sir, I would like to bring to your kind notice, sir. Sir, as far as postgraduate studies are concerned, sir, in the other states, in the convener quota, the fees is reimbursed for postgraduate by the state government, and after completion, they are absorbed as senior residents senior residents in the government colleges. But sir, in the other states, sir, the other states, the convener quota fees is borne by the student, the stipend is paid by the state government. Sir, I request to kindly look into it. If it is possible, we should also implement that. We should also see that. Because sir, the reason why I am saying is that, sir, when we say that, कि the number of seats, sir, the number of postgraduate seats in government medical college are more than double to 1,316 now. Sir, for every postgraduate, a stipend has to be paid. For every postgraduate student, you have to pay him that monthly money. Or shayad, if I am not wrong, it is somewhere around 50 plus or something, 53 or 56. Now they have enhanced it. तो अगर आप देखेंगे सर ये अमाउंट 1,316, then this amount goes up. It's a burden. And as per my calculation, sir, the state government would require for UG and PG interns and postgraduates plus senior residents के जो महाना आप पैसे देंगे yearly, it is going to cross more than 1,000 crores. So we need to see that. We have to have a good planning for that also, sir. And sir, going further ahead, sir, beside taking up the work of augmentation of Nizam Institute of Medical Sciences from 1,500 to 3,500, the Honorable CM Saab has also decided to establish 5 super specialty hospitals apart from 2,000 bedded hospital in Warangal city. 4 super specialty hospitals are being established in Hyderabad with 1,000 to 1,200 beds each. The government hopes to raise the total number of hospital beds in all government hospitals in the state to 50,000, sir. I congratulate you on this also, sir. It is a very big, ambitious program that the government is taking up, sir. It is not easy, sir. I congratulate. He's doing a wonderful work again in this field, sir. Sir, at the same time, sir, when I say that कि ऑनरेबल चीफ मिनिस्टर साहब निजाम इंस्टीट्यूट ऑफ मेडिकल साइंसेस को आगे बढ़ाने का मंसूबा रखते हैं, तो स्पीकर साहब आप भी जानते हैं साहब, हमारे पुराने शहर का एक ही दवाखाना है, उस्मानिया दवाखाना। हम बार बार बोलते रहे उस्मानिया दवाखाने के ताल्लुक से। आज मैं यहां खड़े होकर फिर यह बात दोहरा रहा हूं कि उस्मानिया दवाखाने को आप तामीर करिए, उस्मानिया दवाखाने को नया दवाखाना बनाइए। जब मैं उस्मानिया दवाखाने की बात करता हूं तो उसके साथ साथ मैं ये भी जरूर कहना चाहता हूं कि आप खास तवज्जो रखें कि उस्मानिया दवाखाने में मौजूद मंदिर, मौजूद मस्जिद और मौजूद खबरस्तान को कोई भी हाथ नहीं लगाएगा। यह जरूरी है, क्योंकि बाज लोगों की नातजुर्बेकारी की वजह से जो काम हुए हैं उससे हुकूमत की नेकनामी मुतासिर हुई। मैं उम्मीद करता हूं कि उस्मानिया हॉस्पिटल के ताल्लुक से आप गौर करेंगे। इसके साथ ही साथ ऑनरेबल स्पीकर सर, मैं और एक बात आपसे कहना चाहता हूं कि बार बार मैं मिनिस्टर साहब को बताया भी हूं, लेकर भी जाके दिखाया। आज आप किसी को भिजा के देखिए मिनिस्टर साहब कि चारमीनार यूनानी दवाखाने का क्या हाल है। अगर उस पर तवज्जो नहीं दी गई तो उस्मानिया दवाखाने की तरह वो भी गिर जाएगी। होता यही है कि तवज्जो का अदम शिकार होती है हमारी इमारतें, और उसके बाद में कोई तवज्जो नहीं दी जाती, मखदूज हो जाती हैं, डिलैपिलेटेड कंडीशन में हो जाती है। उसके बाद कहा जाता है कि इसके अंदर जाएंगे तो लोग मर जाएंगे, लिहाजा इस इमारत को गिरा दो, और हमारे असलाफ की यादगार निशानियों को इस तरीके से मिटा दिया जाता है। मैं उम्मीद करता हूं कि निजामिया तिबी कॉलेज पर आप तवज्जो देंगे मिनिस्टर साहब, कुछ पैसा दीजिए साहब। मैं 10 साल से पुकार रहा हूं, चीख रहा हूं, चिल्ला रहा हूं निजामिया निजामिया, चारमीनार दवाखाना निजामिया, लेकिन आज भी उस पर तवज्जो नहीं है। वो भी गिर जाएगा। उस्मानिया तो गिरने पे है, गिर रहा है, अब ये भी गिर जाएगा। तो खुदारा निजामिया तिबी कॉलेज पर तवज्जो दीजिए साहब कि निजामिया का बहुत बुरा हाल है। मैं उम्मीद करता हूं कि आप इस पर तवज्जो देंगे। और मैंने थोड़े दिन पहले भी आपसे कहा कि बारकस एरिया हॉस्पिटल है चंद्रायन गुट्टे में, और खिले गोलकुंडा का हमारा दवाखाना है गोलकुंडा में, और नामपल्ली हॉस्पिटल है, उस ताल्लुक से भी कहा। और फिर से मैं कह रहा हूं, अफसोस होता है मुझे कहते हुए ऑनरेबल स्पीकर सर, बहादुरपुरा असेंबली कॉन्स्टिट्यूंसी में एक छोटा सा हेल्थ सेंटर है पालम रोड पे, और उस हॉस्पिटल कमाटीपुरा में, पालम रोड में, मिनिस्टर साहब बहादुरपुरा असेंबली कॉन्स्टिट्यूंसी में सिर्फ एक ही है छोटा सा हेल्थ सेंटर पालम रोड में, उसकी बड़ी जमीन है। वो हॉस्पिटल के लिए कुछ पैसा दीजिए ताकि उसको डेवलप कर सके। पुराने शहर में एक छोटा सा एक 100 बिस्तर का दवाखाना पालम रोड पे आ सकता है, एक 100-150 बिस्तर का दवाखाना गोलकुंडा में आ सकता है, एक 100-200 बिस्तर का दवाखाना हम बारकस में भी कर सकते हैं। और इन सारे हॉस्पिटल्स में हम बार बार बोलते रहे डायलिसिस सेंटर के लिए, डायलिसिस सेंटर का हम मुतालबा कर रहे हैं। उम्मीद करते हैं कि मिनिस्टर साहब वो डायलिसिस सेंटर के ताल्लुक से भी जरूर हमदर्दी के साथ गौर करेंगे और पुराने शहर के लोगों के सेहत के ताल्लुक से भी आप वही दिलचस्पी लेंगे जो रियासत के दूसरे इलाकों के लोगों के ताल्लुक से आप लेते हैं। सर, अनदर वेलकम इनिशिएटिव इज द डिसीजन टू एस्टैब्लिश a 100-bedded hospital in every assembly constituency in the state. Such hospitals are sanctioned in 107 assembly constituencies, sir. I thank the Honorable Chief Minister Saab, I thank the Honorable Finance Minister and Health Minister Saab and the Government of Telangana for this achievement, sir. Sir, another good initiative has been the establishment of Basti Dawakhana in the municipal areas of the state, particularly in GHMC area. There is a need to strengthen these Basti Dawakhana with more staff, stocking of adequate quality of medicine, equipping them with diagnostic facilities, etc. Also, there is a need to establish more dialysis centers all across the state to provide free dialysis to the poor patients, sir. Honorable Speaker, sir, when I talk about poor patients, sir, I would like to request through you, sir, from last 5 years I've been requesting, sir. Sir, this is about Arogyashri rates. Arogyashri rates, sir, needs to be enhanced, needs to be corrected, sir. It has been more than 10 years that the Arogyashri rates have not been enhanced. But at the same time, sir, I thank the Telangana government for increasing the amount from 2 lakhs to 5 lakhs, sir. This is a very good initiative. I thank the government. Sir, when I say that to increase the Arogyashri tariff, I request the Honorable Minister Saab kindly review all the hospitals who were permitted for Arogyashri cases and they are not doing or taking Arogyashri cases, their registration should be cancelled. The moment you are going to enhance the rate, all these hospitals will jump in that. When the rates are less, they don't want to take the cases. When the rates are enhanced, they will jump. So before enhancing, sir, you should call for the list of all, the empaneled list of all the Arogyashri hospitals, treating hospitals, and see that which hospital has not taken or admitted an Arogyashri patient from a long time. साहब उनका आप registration cancel करिए और नए hospitals को लीजिए. And at the same time, sir, Malla Reddy साहब is here. He will agree with me. वो अग्री करेंगे मेरी बात को। सर, टीचिंग हॉस्पिटल्स के लिए सर आरोग्यश्री में बहुत से केसेस है जो सिर्फ गवर्नमेंट हॉस्पिटल्स में है। आरोग्यश्री में बहुत सारे केसेस, वो केसेस को टीचिंग हॉस्पिटल्स को दीजिए साहब। टीचिंग हॉस्पिटल्स को इफ यू आर गोइंग टू गिव, द टीचिंग हॉस्पिटल विल गेट अ टीचिंग मटेरियल, सर। सर, नाउ दैट यू आर कमिंग अप विथ सो मेनी हॉस्पिटल्स, so many medical colleges, I am sure, sir, the private medical colleges will have a tough time getting the OP, getting the IP. So for that, I request the Honorable Finance Minister Saab, Health Minister Saab, to kindly see that these cases which under Arogyashri, which can be done only in government hospitals, should be allowed to private hospitals, teaching hospitals only teaching hospitals who have medical colleges. Honorable Speaker, sir, KCR Kit Scheme and KCR Nutrition Scheme are good initiatives, sir, which have led to increase in institutional deliveries to 100%, sir. The KCR Nutrition Kit Scheme introduced in 2022 is expected to benefit 6 lakh pregnant women every year, sir. तो मैं ये इसलिए बता रहा हूं कि ये भी गैर मामूली कामयाबी है हुकूमत की। KCR किट की इसके लिए मुबारकबाद देता हूं। I would like to point that the record allocation of rupees 11,595 crores for health and medical services in the state budget for 2023 to 2024 works out to 3.99% of total budget. In the previous financial year 22-23, rupees 10,711 crores was allocated, which works out to 4.17% of the total budget, sir. Allocation for upgradation of facilities and provision of infrastructure and equipment at teaching hospital and state capital are also not adequate, sir. Sir, Osmania, Gandhi, Nilofer, chest, MNJ, cancer, fever, ENT, Sarojini Devi Eye Hospital, mental hospital, maternity hospital at Petla Burud, Sultan Bazar, and Shalibanda and area hospital at Barkas, Malakpet, Golconda, Anampally, Kinkoti requires more funds for expanding the facility and additional of beds, since there is rising demand for deliveries and surgeries at the government hospital to avail benefits under KCR kit scheme, sir. Sir, Honorable Speaker, sir, the Gandhi Hospital and Osmania Hospital are running out of beds, since they are flooded with hordes of patients suffering serious disease and requiring urgent treatment, sir. So there is overcrowding in emergency, gynecology, medicine, and surgical wards of these two general teaching hospitals. Although the Gandhi has a strength of 1,900 beds, even then it is not able to meet the current requirement. It is premier tertiary care institution, but the patients have to sleep on the floor, sir. Sir, also I have spoken about the Osmania हॉस्पिटल के बारे में मैं आपसे बोला हूं. मैं उम्मीद करता हूं कि आप जरूर इस पर गौर करेंगे. और चीफ मिनिस्टर रिलीफ फंड में भी सर हम कई लेटर्स देते हैं, उसमें जितना भी अमाउंट हम देते हैं, तो अगर 1 लाख का बिल दिए तो उसको 50,000 आता है. तो मैं आपके जरिए हेल्थ मिनिस्टर साहब के तवज्जो लाना चाहता हूं कि सीएम रिलीफ फंड में हम जो देते हैं सीरियस एलिमेंट के लिए जो जितना पैसा जो ट्रीटमेंट का आ रहा है, उसका कम से कम 80% तो भी आप दे दें तो बड़ी मेहरबानी होगी. उससे गरीब का एक फायदा होगा. तो मैं उम्मीद करता हूं कि आप इस पर भी जरूर तवज्जो देंगे और जो जो मसाइल मैंने उठाए हैं इस पर आप जरूर हमदर्दाना गौर करेंगे. और मैं आपसे फिर से यह बात जरूर कहूंगा कि रियासत तेलंगाना हेल्थ के सेक्टर में बहुत तेजी से आगे बढ़ रहा है और वो दिन दूर नहीं है कि हमारे मुल्क हिंदुस्तान में, भारत में नंबर 1 स्टेट होगा हेल्थ के फील्ड में, तो वो तेलंगाना होगा. मैं मुबारकबाद देता हूं और आपने जो मौका दिया मुझे, इसका मैं शुक्रिया अदा करता हूं.